Hello, my name is Jared, and I'm doing my project on cholera, the global health challenges, and let me get into it. This is for my final project. So, just a brief introduction on cholera. Cholera is an illness that is caused by the bacterium Vibrio cholerae. Cholera is a Greek word that is derived and associated with the imbalance of bodily fluids, particularly bile. Initially, cholera was used to describe diarrheal illnesses, but today we refer this disease primarily transmitted through contaminated water or food sources. In this paper and project, I really explored disease agents, the symptoms, the prevention strategies, the environmental factors, and some current distributions of the mortality trends within cholera. So let me just get into that in this presentation. So for the disease agent, the primary causative agent of cholera is Vibrio cholerae, a gram-negative bacterium that typically resides in aquatic environments, particularly brackish water or coastal regions. The bacterium can also be found in river, riverine, like ravine ecosystems where I would say like freshwater systems interact with saline water systems. This provides a suitable habitat for survival. And there also are several serogroups of Vibrio cholerae, but only O1 and O139 were a known cause for the cholera outbreaks. Transmission occurred primarily through the fecal oral route, where bacteria from the stool of an infected person contaminated drinking water or food. The situation is really prominent in areas within I mean, the situation for cholera is like really prominent in areas without adequate sanitation and treatment facilities. This ultimately leads to like outbreaks, especially in overcrowded conditions where water contamination is rampant. Environmental factors significantly influence the presence of this transmission of Vibrio cholerae. Some of these influences can be temperature, salinity, nutrient availability in aquatic environments, directly impacting the bacterium's viability. Higher temperatures are also an influence, and salinity levels in coastal waters have also been correlated with increased cholera outbreaks. The bacterium's rapid growth in warm nutrient waters facilitates the infection, emphasizing the need for like detailed preventive measures and understanding of the ecological dynamics of the disease. So just to move forward, let me get into some symptoms of cholera. So just to begin, cholera is often starts off as a mild symptom, but can really quickly escalate into becoming a rapid acute problem known as acute diarrhea, or also known as rice water stools. And in my research, I learned that this term rice water stools was characterized as like a milky appearance due to the presence of mucus in your body. Some of the symptoms within cholera typically develop within 12 hours to 5 days after exposure to the contaminated source, with an incubation period averaging from 2 to 5 days. So, alongside diarrhea, patients may experience some symptoms like vomiting, leg cramps, dehydration, restlessness, and untreated cholera can eventually lead to a severe dehydration, kidney failure, and in most cases, death if untreated. The rapid hydration and medical treatment plays essential and critical roles in managing the condition, but a significant percentage of patients may succumb to the disease if prompt care is not provided in essential time. The classic symptom of cholera is profuse diarrhea, which ultimately leads to rapid fluid loss. This necessitates the immediate rehydration therapy to prevent fatal outcomes. Another important thing is like the oral rehydration solution primarily comprises of salts and sugars. This ultimately enhances like the fluid absorption in the intestines. So like for most cases, I would say in most cases, an IV is really, really essential, especially when like the patient cannot retain the oral fluids due to this excessive vomiting. The provisions of antibiotics can also be a significant factor in reducing the duration of diarrhea and the bacterial shedding that is happening when contracting cholera. Um, so just to move forward, there are some prevention and intervention tips that I did look up. Effective prevention techniques of cholera outbreaks hinges on several strategies. Some of these strategies primarily include the provision of access to clean water, uh, adequate sanitation facilities, and proper hygiene practices. In my research, I saw that the World Health Organization really advocated for integrated approaches that included strengthening water, sanitation, and hygiene interventions. In this term that I saw, which is called WASH. WASH is like hand washing with soap and safe food preparation, and the consumption of boiled or chemical treated water are essential preventive measures that can help diminish the presence of cholera in society. Another another important tip is like vaccinations, particularly the oral cholera vaccine, has emerged as a pivotal tool in controlling outbreaks and is recommended in high risk areas. For example, like community engagement and education are vital in promoting these practices because they emphasize the importance of seeking medical intervention upon the appearance of cholera systems. So, for example, during these outbreaks, implementing like the wash activities I um, expressed previously would help include distributing cholera prevention kits and conducting hygiene promotion campaigns, and can also drastically reduce the transmission rate. This multi-faceted approach, I believe, would really include also really includes like establishing a I would say a robust surveillance system to detect and accordingly respond to cholera cases promptly, really mitigating the potential outbreak within our society. So to move on, I really want to talk about like the environmental factors within this disease. Specifically, like the environmental conditions significantly influence cholera's transmission dynamic. The bacterium's life cycle within aquatic ecosystems plays a really essential role in when you want to determine when and where like this outbreak occurs. So what you want to look for in determining this is like factors such as temperature, salinity, and the presence of phytoplankton, which directly impacts the viability of the Vibrio cholerae in the water bodies of the disease. Another important environmental factor is like seasonal patterns are also notable to point out because with peak cholera cases occurring during or hev- often occurring during or after heavy rainfall when floods can overwhelm sanitation systems and contaminate water supplies. This causes for several studies to note that cholera incidence peak in regions following significant rainfall correlated with water temperatures. So I really feel like understanding these seasonal and environmental factors is crucial for effective cholera surveillance and prevention techniques, which can help us control strategies, particularly in regions experiencing climate change effects, which can really heighten the presence of cholera in that society. Another thing is like elevated temperatures combined with deterioration of sanitation infrastructures, also extreme weather conditions really do create environments conducive to cholera outbreaks. As shown in the research from the World Health Organization, patterns observed in cholera, the patterns observed how would I say this? Actually, so like from my research, I saw that it was evidenced that patterns observed of the cholera outbreak are really prominent in places of not near North America, so like Africa and Asia, just to name two main places where cholera is really prominent. So like for the disease distribution, cholera really remains a significant global health concern also, particularly in low income countries where access to clean water and sanitation is inadequate. Annual estimates indicate that there are between like 1.3 million to 4 million cholera cases globally. And this ultimately can approximately lead to 21,000 to 143,000 deaths annually. Majority of the cholera morbidity and mortality occurs in sub-Saharan African or South Asian parts of Latin America, where these socioeconomic factors can play substantial roles in disease vulnerability. Also, differences in cholera distribution are also evident across demographic scales. For instance, children under 5 years old represent a significant proportion of cholera cases due to their psychological susceptibility and the impacts of malnutrition. Cholera outbreaks disproportionately affect marginalized populations and are closely associated with factors such as like poverty, education levels, and access to healthcare services. For example, a significant number of cholera deaths continue to occur in communities experience conflict and political instability, which really exasperates the challenges, I would say, in accessing medical care and sanitation preventive measures. So finally, cholera really presents a resounding challenge in public health, I believe. Like it underscores its dynamic transmission pathways, um, and substantial mortality rates associated with delayed intervention. Although cholera can really effectively treat, although cholera can be effectively treated and spread minimized through concentrated preventive efforts, I think addressing cholera through an integrated framework that merges improved sanitations and reliable healthcare and community engagement is really a crucial combative is really a crucial preventive strategy that can help combat this persistent health crisis. So moving forward, I think continuous efforts in enhancing surveillance systems, financial stability, foundational healthcare, and sanitation infrastructure are necessary to ultimately reduce cholera's burden, burden globally, ensuring the vulnerability of populations are adequately protected against this deadly disease. And that's all I have for cholera. Thank you.